Hello everybody, this is Dr. Tyler Evans from Arete Chiropractic, and we are coming at you live in Portsmouth, New Hampshire. It is hot outside because it is July 9th, and it is beautiful sunny weather here in New Hampshire. So today we are going to talk about CSF, Cerebrospinal Fluid. Kind of a lot of big words there, but this paper that we are discussing is titled Cerebrospinal Fluid Stasis and its Clinical Significance. CSF, cerebrospinal fluid, is the fluid that goes between the skull and the brain. It actually bathes the brain and is underneath the blood-brain barrier. And so what it does is it's a absorbent layer around the soft tissue of the brain, which the brain is actually mostly liquid anyways. We think of it as this hard thing, but it's not really. There's a lot of rabbit holes that we can go down on that one, but it's not like if you jostle the brain, the brain is this hard thing rattling around inside the can. There's very little space inside the cranial vault, inside the skull, where the brain lives. And there's this very thin layer where cerebrospinal fluid wraps all the way around the brain and goes down the spinal cord. So it looks something like this. I'll just show you a picture here. Actually, let's do this. So first, we have this picture here, which here's your brain, okay? It sits inside your skull, and then if you look real close, you can see this tiny little gap in between the skull and the brain, the soft tissue here, and on that outside layer is where the CSF goes. And actually, if you cut the skull down the middle, so this picture here, we don't really think about this either, but the brain is actually full of holes on the inside of it. We think of the little bumps on the outside, but there's lots of holes on the inside. And these, what they're called, are cisterna and canals through which the CSF, cerebrospinal fluid, flows. So when we look here, this number 1 is where the CSF is actually created. It starts here and then it trickles down. These are called the lateral ventricles, and so they actually look like this. It's kind of wild if you think about it. So here are the blue is empty. Well, it's not empty space, it's full of CSF, but it's basically like a big space inside of the brain. And so the fluid is created in these big horns here, the lateral ventricles. And these ventricles, there's cells called choroid plexus, and these cells produce tiny little amounts of this fluid of the fluid, and so that fluid is then pushed down these ventricles and into the next ventricle, which is these are called the first and the second. This is called the third ventricle. And then it trickles down through this canal into the fourth ventricle here, which is actually quite large and sits just above right in the brainstem, right above the brainstem. So you have this canal system inside the brain that is creating and pushing fluid down, and then what happens is it makes its way all the way down, and then it kicks out and goes down around the spinal cord. Now, this paper talks about the importance and breaks down all the anatomy of the cerebrospinal fluid flow, and that's not here or there, but the importance of it is that fluid flow, it goes along the heartbeat, and it goes with respiration, it goes with movement. And so when your heart beats, we can actually see the fluid push. And it's not like blood. When our heart beats, it pumps through arteries and veins. But in arteries, it's very directional, and it just goes. But with CSF, it's it's less directional. It's more, I forget what the term that they used was, but it's kind of like path of least resistance. So it kind of finds its own way. There's no, tunnel. There's no like real defined tunnels through which it goes, and so it just kind of makes its way. And so what can happen is this thing called stasis, and it's not in the title here, but this paper is all about cerebrospinal fluid stasis, and when the CSF gets stuck. So when the CSF gets stuck, now we have a problem. So that's when we have abnormal physiology, or we have pathology that starts to happen. And this paper was published back in 2009, and another guy, Michael Flanagan, he talked about craniospinal hydrodynamics. That's a paper that I've talked about in the past. That paper came out a couple of years ago. But we're getting a lot of information about how the CSF is not just this little clear liquid that we don't really know why it's there. It serves some major functions, like removing toxins away from the brain. So if that CSF is stopped, if it's in a static pattern, if it's in stasis, the toxic metabolic waste of the brain, because the brain is constantly creating and burning energy through the constant firing of the neurons and the neurology up there. So there's this kind of like off product, and it's got to get away. It's got to get away from the brain. And so this is a big thing that's not getting talked about a lot yet, but it should be, and hopefully will be in the future. But it's basically a problem where when you have an injury to the brain or the neck and the base of the brainstem here is a channel through which all of that fluid has to get away. And the CSF also brings nutrients to the brain. So if this balance is off, if the nutrients aren't getting to the brain and then getting pulled away, then we start to have what are called little plaques and proteins build up in the brain. There's a thing called CTE, or chronic traumatic encephalopathy. It's a thing that the NFL is very worried about right now because football players hit their heads a lot. And we're finding that when later on in life, they develop this problem called CTE, and there's lots of, I'm not going to get into it, but there's lots of bad things that happen. And a few of the football players have committed suicide because they're literally, they're not themselves anymore. They can't remember what happened a minute ago, and they're becoming, violent and aggressive, and there's a lot of bad things that are happening with it, but it's called CTE. And a lot of these extreme athletes, the X Games athletes, they're all coming down with this thing later on in life. And the tau proteins are building up in the brain. The CSF is not getting away. However, there is one or many modalities actually that look at getting that fluid out and helping that fluid get away. And so, a couple of those modalities would be like craniosacral therapy. And craniosacral therapy and the Upledger Institute, John Upledger, those guys have been around for a while, and they talk about that rhythm between the CSF flow in the brain and the sacrum, and getting that rhythm and flow back, that pattern of pumping. And they see some great results with all kinds of things like headaches, migraines, neck pain, you name it. And guess what? Upper Cervical Chiropractic care as well. So there's a good friend of ours, a mentor, Dr. Scott Rosa in New York. He's been doing pre and post movie MRIs of CSF and how it moves. And so there's a website called phonar.com. If you go on that website, you can see many really cool videos and studies on that flow of the CSF. And so anyways, it's a fantastic brand new way to look at how chiropractic and craniosacral can really help the brain heal. And so, just a quick shout out to Dr. Rosa and some of the people that are doing that great work. And the phonar.com is the website you can look at for that. It is, hi Joe, good to see you, man. Thanks for being on. And Dr. Rosa, and there are actually a handful of other upper cervical docs that have been working on this CSF flow problem, and we see it in our practice every day, where it literally feels like the pressure is leaving the brain, because when you correct the neck, it's allowing that fluid to flow again, get that cerebrospinal fluid flow back, and stopping that static stasis of the CSF. So anyways, Dr. Tyler Evans from Arete Chiropractic, if you have any questions about cerebrospinal fluid and how upper cervical chiropractic care can help that CSF flow again, we're happy to answer questions, and we'll see you next time. Have a great week. Bye-bye.